Good afternoon. My name's Robin, and I'm a student nurse from SPC College.
Hi, Robin.
Hi. I was wondering if I could shadow you for a little bit today.
Sure, no problem.
Okay. Are you working with a patient right now?
I am. I'm about to go in and see Mr. Lutz.
Oh, cool. Can I get SBAR?
You sure may. Mr. Lutz is a 67-year-old male. He's a full code. He's 5'11", 171 pounds. He has no known food or drug allergies, but when we go in, we'll double check with him. He came in from the doctor's office complaining of a ulcer on his right heel and high glucose readings for the past 5 days. And he's had the pressure ulcer on the lateral aspect of his right heel for 3 weeks.
Oh.
So he's coming in for glucose control, some diabetic teaching, pain management for his wound, and also a wound evaluation.
Okay. Cool.
So he has a history of diabetes for 20 years, also hypertension and high cholesterol. He had a prostate resection 5 years ago also. He's ANO times 4. He has visual impairment, but he does wear glasses. He's ambulatory. He was given morphine at 1610, so now his pain's a 1 out of 0 to 10, but
Awesome.
We'll double check that when we go into. He drinks 1 16-ounce beer every Friday when he goes bowling. His respirations are even and effortless. His pulse is 76, his blood pressure 128 over 70, and pulse ox is 96% on room air. He denies any chest pain, dyspnea, nausea, vomiting. He does have diabetic neuropathy and he does complain of tingling in his lower extremities for the past 3 months also, but he denies the triple Ps.
Okay.
Okay.
And you won't be in that anyway. You'll be in this, so you can check your
So, are you going to give him any medication right now?
Yeah, we're actually going to give him 2 insulins because of his diabetes. His body either produces too little or no insulin at all.
Okay.
So we're going to give him regular insulin and NPH
So,
insulin.
and why are you giving the medication? That's just because of the diabetes, or?
Because of the diabetes, because of his high glucose, his body's not producing the insulin, so we need to augment it.
Okay, and then what action does the medication have on the body?
Insulin is actually a facilitator for glucose to enter the cells, especially of muscle and adipose tissue. It also increases or facilitates amino acids and potassium also to enter the cells.
Okay, and then when should you question administering the medication?
Definitely based on his glucose readings. If his glucose is like below 70, we would definitely want to hold medication.
Okay. And does the medication have a therapeutic, therapeutic serum level?
It does not. What we base it on is the glucose readings.
Okay.
So,
And then what vital signs are we looking at when you're giving the medication?
we would look at all his vital signs, but especially his heart rate, because that could be a sign of hypoglycemia.
Okay.
So also his the way he looks, if he's cold or clammy, we would also look at mentation. So if there's any confusion, we would want to delve further into that as well.
All right, and then so that kind of answers my next question, though. What physiological parameters should be monitored when the medication's being administered?
Yes, that would be cold and clammy, tachycardic, possibly greater respirations as well. So.
Okay. And what interventions do we need to teach the client to ensure the medication is administered safely in the hospital setting?
Well, in the hospital setting, we'd want to make sure that he's aware of the medications that he's getting. And if he doesn't, then we would want to teach him about those, especially the insulin. Because he does have a recent history of readings in the 300s over the past couple days, we want to make sure and maybe do some teaching with him to see if he's administering it correctly when he's at home. So.
And then, so what interventions do we need to teach? Because you had mentioned about him taking it at home. So how do we make sure that he's administering the medication safely at home?
Well, when we go in and see him, we'll see if there's any visual impairment, see if he's able to pull up the correct amount because he's on regular insulin. That's on a sliding scale, so based on his blood glucose, whatever he would get at home, he would want to make sure he's getting the correct units.
Okay.
And also, as far as safely administering it, if he's doing it in his stomach or wherever, make sure he's cleaning the area correctly, and that. So.
And then what are the side effects and potential adverse reactions for the medications that you're giving for the insulin?
For the insulin, as mentioned before, the hypoglycemia, that's a main one. Also, we want to look at for any allergic reactions, the most important being anaphylaxis, which is systemic.
Yeah, that would be
that's
bad.
life-threatening.
Yeah.
Since he's been on insulin for the past 20 years, that's probably not likely, but we also still want to watch out for it.
Yeah. Okay. And then how do you know the medication's effective?
Well, he gets blood glucose readings 4 times a day. So after he gets his injection, his glucose is going to be read again, and we're going to see if it's trending down towards a normal range.
Okay, cool. All right, well, that answers all my questions that I have now. Do you mind if I watch you give the medication?
Of course not. Let's go in and see Mr. Lutz.
Okay, cool.
Hello.
Hi, Mr. Lutz.
Hi.
My name's Richard. I'll be your nurse today.
Hi, Richard.
This is Robin. She's a level 1 student nurse. Do you mind if she comes in and watches?
No, that's fine.
Hello.
Okay, wonderful, wonderful.
Okay.
Okay. Are you in any pain right now?
No, not really.
Okay. What would you say on a scale of 0 to 10?
Oh, it's about a 1.
Okay, so that morphine that I gave you earlier, that's working pretty good.
Oh, yeah, it's working great.
Okay, wonderful, wonderful. Do you have any allergies to foods or medications?
Nope.
No? Okay, great.
Nothing that I know of.
Okay, and I'm going to be giving you some insulin
Okay.
today, okay, because your last blood glucose reading was 242.
Okay.
Okay, and that was about half an hour ago. And it looks like you should be getting a ADA diabetic diet food tray soon. Is that correct?
Yeah, I ordered my dinner a little while ago.
Okay, wonderful, wonderful. We're going to go ahead and do the insulin administration, and then we'll do some teaching as far as, because I know you would come in about your diet, see if we can give you some options for that,
Okay.
and also make sure you're doing the insulin correctly at home.
All right, sounds good.
Okay. How's your foot doing?
It's okay.
It is? Okay, it looks like there's a consult for a wound care nurse to come in and speak with you about that too, okay?
That's what they tell me.
Okay, okay. Well, I'll check up on that too, okay? Make sure she's coming in. Okay. Can you give me your name?
Sure, Greg Lutz,
Okay, and your age?
67 years old, if you can believe that.
No, I can't. Look very good for your age.
Why, thank you.
Good. These computer systems,
They're kind of tricky.
they are.
If you need any more help, because I'm going to have him.
Go ahead and pull that needle.
Put it in here. Then set it up.
Okay, so we have NPH insulin, which is a intermediate insulin. That's
Okay.
more for a basal or a long-term coverage.
Mhm.
Okay, and then we have regular insulin, and that's for when you eat. It'll give you meal coverage for that.
Oh, okay.
Okay. Okay, and you also want to check for the expiration date too.
Right.
Mr. Lutz, where do you normally have your insulin injections done?
In my belly.
Okay, whereabouts on your belly did you have it last time?
Right about here.
Right about there? Okay, so we're going to do it on the right side this time, okay?
Okay.
If you if you move it around in kind of a checkerboard pattern, when you do it each time, it helps prevent, it's called lipodystrophy, but it's scar tissue buildup, and that could
Okay.
that could affect the absorption of the insulin.
Okay.
body, okay?
I'll be sure to keep that in mind.
Okay.
Potassium chloride. So we're going to give you that as a first start with, and then your medication is going to be gentamicin. Gentamicin. We're going to give you a gentamicin in an IV PD bag, that means just a smaller bag. We're going to infuse this with your so the only thing we want to ask should be good. Yeah, yeah, so I have a little bit of information for you. So you know that the drug that you're taking, I'll give it to you. So this is, as I said, this is gentamicin. It is for your bacterial infection with E. coli that you are and so what we're going to really need to know is
Okay. You have to scan your badge a second time.
we're going to
Give me your last name and age again?
Yeah, Mr. Lutz, 67 years old. I don't think anything's changed.
Okay, well, it's always good for us to double check. We want to be very safe with this, okay?
That makes sense.
Check expiration again. Okay. Robin, you have any questions?
Not right now. I'm just watching to see what you're doing.
Okay, great. Back here. We want to make sure that we clean the top of our insulin bottles too with alcohol swab.
And that just prevents it from getting contaminated.
Yes, yes. You don't want to introduce any germs. So, Mr. Lutz, when you're at home, do you clean the injection site before you give it to yourself?
Yeah, I just do that with soap and water, though. Is that okay?
That's fine for when you're at home.
Okay.
And as I said, you are getting gentamicin, but first I'm going to...
And you've heard the term clean it like you mean it, right?
Yep, I think that's what my instructor keeps telling me to do. And that's for the injection site and for the tops of the vials and just pretty much everything.
That's correct.
but I'll break that in my mind before I even put them in the what's right when you come in the room. This is right there. Just make sure when you do.
Okay. What we're going to be doing is we're going to be giving you 16 units of regular insulin based on your reading of 242.
Okay.
Okay, that's what the doctor ordered. And we're going to be giving you 20 units of the NPH. Okay?
Okay.
So 16 plus 20 would be how many units total?
No, you can't.
36?
36? Okay, great.
Write it where you need it.
What I'd like to do is have you go ahead and pull up 36 units just to show me that you're pulling up the correct amount when you're at home, okay?
Is this helping you as well?
Yes.
Okay.
I learned by observing. I mean, that's why I'm like...
These are awfully
that's why I
tiny.
like going
They
live
are
on
very
the
tiny.
answers.
Is it difficult for you to see that?
No, I can see it okay.
Okay, great.
Okay. You're still looking up information, right? You're fine, right? I don't want to...
Okay,
You're
she's
almost
still
done?
looking.
Okay. I'm almost finished.
I think I got it to 36.
Okay, great. Now you know they also have pens.
That's
you can
usually
use.
what I use at home.
Okay, great. That can usually make it easier for you instead of having to measure like this. So Robin, does that look 36?
Let me check. Yep, I believe it does.
Okay, great.
Good job, Mr. Lutz.
Okay, yes.
I had to focus my eyeballs on that.
Okay. What we're going to do is we're going to inject air into the NPH first, okay? And that's to avoid creating a vacuum when we pull it up.
Okay, and we see that we have marks. And we're going to now check for any indication to mark. We have to mark it. Getting,
And do the same thing with the regular.
and she is getting sodium chloride.
Okay.
And we see that within 1. And now we are going to first.
And you've heard the term clear before cloudy?
Mm-hmm.
Okay, so we pull up the clear first.
So how come the NPH is cloudy?
Actually, the MPH is cloudy because it's a,
Sodium chloride.
what's the word I'm looking for? It's a
Is it like a suspension?
suspension, yes. Thank you very much.
I've been doing my readings. My
You've been doing your
fundamentals
readings?
book. Yeah.
So, that's actually what we want to do. Is that is like that. Very good, you reminded me. What we do is we actually roll it
Oh,
gently
okay.
between our hands.
Oh, 'cause does it settle out or is it always?
This helps to resuspend it
Oh,
so that we're
okay.
actually pulling up the correct amount. Okay.
Is that just 'cause like the not medicine necessarily, I'm not sure what the word for it is, but it just like settles on the bottom and then it's not as
Correct.
constant.
Correct, yes. So we want to make sure that we're giving Mr. Lutz the correct amounts and that it's equal distribution.
Okay.
So,
Now,
okay.
we now set up our
So I want to be careful, and when we recap,
And you just use one
okay,
hand like
just
that?
one hand like that, okay?
And that prevents stabbing yourself, right?
Exactly. We don't want any needle stick injuries. So, okay. So we're going to do it on the right side. Okay. And go ahead and start from inside and move out. Okay.
But I
And
don't
you can
need to do
this.
that at
You
home?
can do this with soap and water at home.
Oh, okay.
Okay. You might feel just a little prick, okay?
Anytime I had a technical issue, I would call her and she likes to
Stabilize it.
Oh, I forgot.
Inject. And then we hold for about 5 seconds, okay?
Just to make sure everything goes in?
Correct. Okay. And then it goes directly into the sharps container. Okay?
Okay.
And then, after we administer it, we're going to want to document it immediately afterwards.
Okay.
And
Just so you don't
then-
forget or anything like
Correct.
that.
Yes.
I know. Baby, that's just. Right now, we're gonna just hook up our and I will tap until I set up the pump. Now we're gonna set up the pump. So let's just say. Bye. We're gonna. We have a few patients. Let's push.
Okay.
Patient ID. We're going to take
Well, I'm having computer problems here, but we're
Oh
good.
no.
Those darn computers.
Is it doing that shaky screen thing?
Nope. No, looks like we might be okay. Let's see. Okay. Mr. Lutz, I have some information for you that you can read over. It's about diabetes and foot care and how to watch so we can avoid getting some other injuries like this, because I know with your diabetes you have trouble feeling sometimes.
Yeah,
You
I
get
don't
the
feel my
tingling.
feet very well.
Okay, well this will help give you some information on how to keep it clean and how to look for any potential injuries before they get too bad.
Okay.
Okay? And this also has to deal with your 1,800 calorie diet, okay, and 2 grams of sodium restriction, because I know you've had some problems with sticking with it recently.
Yeah, I'm not so good with
So
that.
this gives you some suggestions, for your meals,
Okay.
and also you can actually make up some meal plans for yourself.
Okay,
when
that
you're
might
home.
help me.
Okay, so I'm going to leave this with you, and then I'll come back in, and if you have any questions, we can discuss it, okay?
Sounds good.
So your regular insulin starts working in about 30 minutes, 30 to 60 minutes.
Okay.
So if you don't get your meal tray soon, hit your call button, and I'll make sure that you get it, so we
Sounds
get you
like a
some
plan.
food before. Okay? Anything else?
No, I think I'm okay.
Okay. Well, I'll be in shortly, okay?
All right. Thank
Okay.
you very much.
Thank you, Mr. Lutz.
That was cool.
Yeah.
Didn't get to see anyone give insulin before, so hooray. If you don't mind, I have a couple questions left to ask you.
Sure.
So if now's a good time.
Yes, that's fine.
Okay.
That's fine.
So let's see. You gave him medication, and then were there any pertinent pieces of information you reviewed before administering the meds to the client?
Well, I definitely, with speaking with him, wanted to make sure that he was alert and oriented,
Okay.
and that he was not in pain. His respirations were okay. He wasn't fidgety or
So-
any of the signs of hypoglycemia.
Oh, okay. So it's
So,
okay.
cool, pale skin, concentration,
Mm-hmm.
drowsiness,
all the important
headache,
stuff.
nausea, vomiting, that kind of stuff.
Oh, fun.
Yeah.
And then did the information that you gathered when you were doing that assessment, did it affect your decision to administer the medication?
And most that definitely did. If I had
Okay.
seen anything out of the ordinary, then I would have questioned it and held the medication.
Right. And then, so did the information that you got, did it affect how you administered the medication?
It did. When I was speaking with the patient, Mr. Lutz, he informed me of where he gave his insulin shot last time, so
Right.
that made me move it over to the right side so that we didn't cause any kind of scarring, lipodystrophy, or whatnot. So.
Okay, cool. I think that answers all of the questions that I have, so I'm going to go see if any of the other nurses are doing anything exciting. But if you need me, let me know.
Okay.
And have a great rest of your day if I don't see ya.
Okay, thanks, Robin.
All right.